Take two and call us in the morning. Twin doctors, Dr. I and Dr. J, are waking up with us, answering your burning health questions about medical wives' tales, trends. We're covering the gamut today. Good morning, guys. Always good to see you. Let's just get rocking and rolling here. True or false? I teased this before the break. Children who routinely use smartphones before the age of 13 are more likely to suffer from anxiety, depression, and poor behavior. 1,000,000% true.
Yeah, 1,000,000% true indeed. And so it's funny, I was talking to a pediatrician about this just yesterday, and he said his advice was before the age of 3, no devices at all. He said after the age of 3, between 3 and 13, devices are okay, but no more than an hour or two a day, and primarily to be used for educational purposes. And it makes sense when you think about it. The brain is developing when you're before the age of 13, even after 13, but certainly before 13. And parts of the brain like the amygdala, which play a role in mood regulation, and the prefrontal cortex, which play a role in impulsivity, are still developing. And research has shown that you actually see structural changes in the amygdalas and in the prefrontal cortices of children who are on devices frequently. And so they're more prone to anxiety, depression, and impulse control and poor behavior. And so, yeah, it's absolutely true. Before the age of 13, limit the device use. Before the age of 3, no devices at all.
I don't know if this is more of a doctor question or a dad question for y'all, but like when my daughter accidentally grabs for one of our phones, you know, do you grab it away from her immediately? Because it's almost like if you treat it like the forbidden fruit, they just want it more. Or do you just, like, what am I supposed to do with a 1-year-old?
I let them play around with it for like a few seconds, you know, it stimulates that creativity, and then I gently take it and give them something else.
Yeah, look over here. Let me distract you over this way. Okay, true or false? A cup of strawberries a day will keep the doctor away. I'll say true to that.
I am personally offended that you want to keep the doctor away, but it's not necessarily true. It is true, but it's not going to keep the doctor.
There's some caveats there. Yeah.
Caveats. It'll minimize the negative interactions with doctors, right? So strawberries have some really good things. One is fiber. So fiber is going to bind to cholesterol. It's going to bind to blood sugar. So it's going to reduce your risk of high cholesterol, high blood sugar, diabetes, things of that nature. Fiber is also a good prebiotic. So it stimulates the production of those good gut bacteria that help keep us healthy really from head to toe. Strawberries also have polyphenols. Polyphenols are antioxidants. We know that antioxidants reduce inflammation. So antioxidants mean less, gut health issues, less dementia, less joint pain, and again, less heart attacks, less stroke, less heart disease, less diabetes. So if you want to keep the doctor away, Markie, have some strawberries.
Hey, I never said I did. I'm just reading the question. I'm just playing the game, my friends. Here's another one. Let me skip ahead, guys, to the one about brain fog. I want to get to that one. Frequent brain fog is a normal part of aging. Normal? I'm going to say false to that.
Yeah, it's not a normal part of aging, but it can be a part of aging. So when you have brain fog, you just have this altered sensorium. Like you forget things, you don't feel like you're quite right there, Now, a lot of people with menopause do report brain fog. So in that sense, it can be seen with aging. But brain fog can also be related to medications. It can be related to sleep deprivation. God knows I've experienced it. But it can also be a harbinger for dementia and certain neurological conditions. So we tell folks, if you forget where you put your car keys every once in a while, that's fine, especially if you're sleep deprived. But if you find that you're just not able to do the things you need to do during the day, you forget how to get to work, you kind of are constantly forgetting what you need to do just to get through the day normally, that can be a bad sign. You should talk to your doctor.
Yeah. Let me ask you, is brain fog a normal part of 3rd trimester pregnancy? That's my question of the day, because I tell you what, I am some sort of not right, guys. The brain fog, the exhaustion. I was at the gym. This is a true story, and my pants were on inside out for the whole class. Am I okay? No, and just remind me that I will recover from this.
You will recover, and you are okay. That's totally normal. There are estrogen and progesterone receptors in the brain, so mommy brain is a real thing.
Oh, well, okay. Less than 2 months left. We're making it through. It is a journey. Thanks to both of you, as always, for being on. Love to see you. And have a good one, guys. To have your medical or health questions answered on our show, find Dr. I and Dr. J on social media at the Twin Doctors _ or on their website.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.